In over half of all stroke cases, the brain sends a crystal clear distress signal in the hours, sometimes the full day, before the major event hits. Not a vague feeling, not something you have to guess at. An actual, identifiable signal. And most people either miss it completely, or they notice it, feel relieved when it goes away on its own, and do absolutely nothing. That moment of relief, that might be the most dangerous moment of your life. I am Dr. Franklin, and today I am going to walk you through exactly what that pre-stroke window looks and feels like, specifically in older adults, including the warning signs your doctor may never have sat down and explained to you in plain English. Because here is the truth. Stroke is not something that simply happens. In the vast majority of cases, your body is waving a red flag before the catastrophe arrives. The tragedy is that nobody ever showed you what the flag looks like. By the end of this video, you will know what to watch for, what is actually happening inside your body in that moment, and what to do in the critical hours that follow. Stay with me all the way through, because the section closer to the end about something most people completely overlook has saved lives. Genuinely. Let's get into it. Before we go further, if you are new here, I cover preventive health and longevity specifically for adults over 55. In plain language, no fluff, no fear-mongering. Hit subscribe and the bell so you don't miss what comes next. Now let's talk about what your brain is trying to tell you. Most people imagine a stroke as something that strikes without warning, like a light switch flipping off. One moment you are fine, the next moment everything has changed. That image is wrong for the majority of stroke cases, and that wrong image is costing people their lives. Here is what is actually happening inside your body in the lead up to a stroke, and I want you to really picture this. Your arteries, the vessels that carry blood from your heart up into your brain, are not just hollow pipes. They have living walls. Those walls are lined with a delicate layer of cells called the endothelium. When that lining is healthy, blood moves through smoothly, nothing sticks, and your brain gets a steady, clean fuel supply every second of every day. But over the years, through high blood sugar, high blood pressure, smoking, chronic inflammation, that lining gets damaged. It becomes rough, patchy, scarred. And on those rough patches, cholesterol deposits and tiny clots start to accumulate. Over time, the opening inside the artery gets narrower and narrower, not in a week, not in a month, over years. Now here is where it gets critical for people in their 50s, 60s, and 70s. Once an artery is significantly narrowed, it becomes unstable. Little fragments of plaque can break off, tiny clots can form at the narrowed segment, and when those fragments or clots temporarily reduce blood flow to a section of the brain, even for just 1 minute, you experience what medicine calls a transient ischemic attack, or TIA. Transient means temporary. The clot shifts, blood flow resumes, and the symptom disappears. And that disappearing act is exactly what makes a TIA so dangerous, because it convinces people that everything is fine again. It is not fine. A TIA is your body screaming at you that a major stroke is now statistically likely within the next 24 to 72 hours. That window, those hours, is your intervention window. Miss it, and the consequences can be permanent. So let's talk about exactly what a TIA, a pre-stroke warning, actually feels like. And I'm going to go deeper than just symptoms. I want you to understand what is happening in your brain in each of these moments, because when you understand the why, you never forget the what. Warning sign number 1, the face that doesn't match. The first warning sign happens in the face, and it is subtle enough that many people chalk it up to stress, a bad night's sleep, or just getting older. You are standing at the bathroom mirror in the morning. You smile or try to speak, and something is off. One side of your face feels strange, slightly droopy, a little numb. Maybe you notice it when you try to drink something and it dribbles from one corner of your mouth, or you feel a heaviness on one side that was not there yesterday. Here is what is happening. The motor control strip in your brain, the region that sends movement signals down to your face muscles, is receiving reduced blood flow on one side. Because each hemisphere of your brain controls the opposite side of your face, a disruption in the left hemisphere affects the right side of your face and vice versa. What makes this a TIA and not a full stroke is that blood flow is only temporarily reduced. The symptoms may fade within 5 to 15 minutes. You go back to normal and you tell yourself the mirror was playing tricks. Here is the question I want you to ask yourself if this ever happens. Would you recognize it in yourself? Most people are not looking for it. They are half asleep, rushing, distracted. There is a simple 3-step face check I want you to memorize right now. Smile. Does one side move less than the other? Raise both eyebrows. Does one brow not lift as high? Now say a sentence out loud. Does your speech sound slurred or unclear even slightly? If any of those things happen to you out of nowhere, even if they correct themselves in under 10 minutes, that is a neurological emergency that deserves same-day medical attention. Not tomorrow, not after the weekend. Today. Before we get into the next sign, I want to hear from you. Where are you watching from today? Drop your city or country in the comments right now. I read every single one, and it genuinely helps me understand who this community is and what you need from me most. Warning sign number 2, the arm that goes on vacation. The second warning sign involves your arm, and specifically the difference between ordinary weakness and something neurological. We all know what it feels like when an arm falls asleep after lying on it wrong. It tingles, feels heavy, and within a couple of minutes of moving around, everything normalizes. That is a circulation issue from compression. The arm itself is the problem. A pre-stroke warning looks different. You are sitting in your chair, not lying on the arm, not doing anything unusual, and suddenly one arm feels weak, heavy, or difficult to lift. Not both arms. One. And sometimes it is accompanied by that pins and needles feeling, but without any obvious mechanical reason for it. What is happening in the brain during this moment is that the motor cortex, the brain region governing movement commands to your arm, is losing blood supply on one side. The signals from brain to arm are getting interrupted. It is like a phone call breaking up because the tower has a problem, not because the phone is broken. This one-sided arm weakness during rest is a red flag that should not be written off as, I must have overexerted yesterday, or maybe I slept wrong, especially if it resolves on its own within minutes. Here is the open loop I want to leave with you on this one. Arm weakness alone is sometimes missed as a stroke warning because it can feel mild, but there is something else that often appears alongside it, and I'll come back to that combination later in this video because together they mean something very specific. If you're still with us and finding this helpful, type number 2 in the comments so I know you're there, and if you haven't subscribed, please do. Your support keeps us going. Warning sign number 3, the word that disappeared. This next one is deeply unsettling when it happens, and it tends to leave people embarrassed rather than alarmed. That embarrassment is dangerous. You are in the middle of a conversation, or even just thinking out loud, and a word vanishes. Not the normal tip of the tongue experience where you can feel the word circling around and it pops back in a minute. This is different. You open your mouth and the wrong word comes out, or words come out scrambled and you know they are wrong but you cannot correct them. Or words simply do not come at all. Sometimes it goes the other direction. Someone speaks to you, your spouse, your grandchild, a friend, and their words sound like noise. You hear them speaking, but the meaning is not landing. In the brain, 2 regions handle language. One helps you produce speech, the other helps you understand it. Both regions sit primarily in the left hemisphere for most people, and both rely on a specific set of arteries called the middle cerebral artery branches. When blood flow to either of those areas is interrupted, even briefly, speech breaks down in exactly the ways I just described. And when it resolves within minutes because blood flow has temporarily restored, most people rationalize it as a senior moment, as tiredness, as anything other than what it actually is. Do not do that. A sudden, unexplained disruption in your ability to produce or understand speech, even if it lasts only 2 or 3 minutes, is one of the most specific warning signs of an impending stroke that neurology recognizes. Here is the practical test. The next time you are with an older parent, a spouse, or even yourself, notice if words are suddenly wrong, missing, or jumbled, and they were not wrong a minute ago. If so, Get evaluated. That day. Warning sign number 4. The vision that goes double or dark. Here is a question. Have you ever closed one eye and noticed something strange, then figured your eyes were just tired? I want you to think about this carefully. There are 2 vision-related warning signs for stroke, and they get lumped together constantly, even though they point to very different problems. The first, one eye goes dark, not blurry, not double, but genuinely darker, like someone turned down a dimmer switch on just that eye. It typically lasts under a minute and then clears. This happens when a tiny clot or plaque fragment from the carotid artery in your neck travels upward and briefly blocks the small artery that feeds the retina of one eye. Your retina, the light-sensing tissue at the back of your eye, is effectively a direct extension of your brain. The artery that serves your eye branches off the same system that serves your brain. So when a clot can reach that eye artery, a brain artery is the next likely destination. The second vision sign is more alarming to experience: sudden double vision, or a loss of vision in the same half of your visual field in both eyes simultaneously. This is different from one eye going dark. This type of vision problem points toward the back of the brain, the occipital lobe, losing blood supply. The occipital lobe is where visual information from both eyes gets processed and assembled into the image you see. Both of these vision symptoms, especially when they come out of nowhere, last a few minutes, and then disappear, deserve urgent evaluation. Not an eye appointment next week. Not reassurance from a friend. A same-day call to a physician, and, if any other symptoms are present alongside, a direct trip to an emergency department. Vision symptoms tend to be dismissed as eye strain or "I need new glasses." They are one of the most underreported pre-stroke warning signs in adults over 60. If you're still watching and this helps, type number 4 in the comments. If you haven't subscribed yet, hit that button and the bell so you don't miss any future videos. Warning sign number 5. The balance that breaks without reason. We are going to slow down on this one because it is the warning sign that gets misidentified the most, especially in older adults. You are walking through a room you have walked through hundreds of times. Nothing has changed, but suddenly your balance is wrong. Your foot lands in the wrong place. You veer slightly. You reach out for the wall, or you are sitting completely still and a wave of spinning hits you. Not a gradual dizzy feeling, but a sudden intense sense that either you or the room is moving violently. The part of your brain responsible for balance and coordination is called the cerebellum. It sits at the base of your skull, and it is constantly receiving signals from your eyes, your inner ear, and your joints about where your body is in space. It uses all of that data to fine-tune every movement you make so you walk straight, reach accurately, and stay upright. The cerebellum is fed by a completely different set of arteries than the ones supplying the front of your brain. These arteries run up through the bones of your neck, the vertebral arteries, and they are prone to their own form of narrowing and clot formation. When blood flow through those arteries drops suddenly, even for a moment, the cerebellum essentially loses its input signal. The result is abrupt unsteadiness or intense vertigo that appears with no warning and no obvious trigger. You did not turn your head quickly. You did not stand up suddenly. You did not roll over in bed. This is where I want to be very direct with you. Dizziness and balance problems are common in older adults, and they have many causes: inner ear problems, medication side effects, dehydration. These are all real possibilities. But here is how you separate concerning from routine. A TIA-related balance problem tends to come with company. Sudden vertigo alongside slurred speech, vision changes, or one-sided numbness is not an ear problem. That combination, especially appearing together for the first time, is a neurological emergency that requires imaging, not a wait-and-see approach. If you have ever had a sudden, unexplained balance episode that cleared up in a few minutes and you never got it checked out, put it on your list to discuss with your doctor, even if it happened months ago, because the next episode might not be brief. Remember earlier I told you there was something about the arm weakness warning that becomes even more significant in combination? Here is the payoff on that. The pattern neurologists watch for most carefully is not a single symptom. It is when two or more of these warning signs appear together, even briefly, within the same time window. One-sided arm weakness paired with slurred speech, vision going dark in one eye combined with an unusual headache, sudden balance loss appearing alongside facial drooping on one side. When symptoms pair or stack, they are no longer ambiguous. They are pointing to a specific blood vessel territory in the brain that is under significant stress. And in stroke medicine, the clinical rule is this: if you are seeing symptoms from two or more of these categories simultaneously, you do not wait. You call emergency services immediately, even if the symptoms are beginning to resolve. Why does resolving matter? Because in a hospital, even with symptoms that have already faded, doctors can perform imaging that shows which blood vessels are at risk. They can see the plaque, measure the narrowing, and in many cases intervene before the blockage becomes complete. The 72-hour window after any of these warning signs is where the most effective stroke prevention happens. It is the window that most people don't use. What is happening to your vessels over time? Let me take a step back here because I think understanding why this happens to older adults specifically will make you take the earlier warning signs more seriously. After the age of 55, the rate of arterial wall damage from the same risk factors accelerates. High blood sugar that might have caused slow, modest changes in your 40s is doing meaningfully more damage per year in your 60s. Blood pressure that your vessels could partially compensate for at 45 causes more wall stress and more plaque instability at 65. There are two specific processes I want to highlight. The first is something called endothelial dysfunction. That inner lining of your arteries, the smooth, non-stick surface we talked about earlier, progressively loses its ability to regulate blood vessel tone with age. Healthy arteries expand and contract in response to demand. They dilate when more blood flow is needed. They constrict to raise pressure when necessary. An aging, damaged endothelium loses that flexibility. The vessel becomes rigid, and a rigid vessel with narrowing from plaque is the textbook setup for a stroke. The second process is nocturnal blood pressure drop. During sleep, blood pressure naturally falls by roughly 10 to 20%. For most people, this is a healthy physiological pattern. But for an older adult who has a significantly narrowed artery due to plaque, that nighttime blood pressure drop can reduce flow through the narrowed segment to near zero, especially if a small clot has formed there during the day's inactivity. This is one explanation for a pattern clinicians see regularly. A person goes to bed feeling fine and wakes up with stroke symptoms, or is found by a family member unable to move or speak. The stroke did not happen while they were moving and active. It happened in the hours when blood pressure quietly fell and the already tight artery could not maintain flow. Understanding this helps explain why evening or overnight warning symptoms should never be dismissed as "I was just groggy" or "I must have slept in a strange position." 3 things to ask your doctor. Now, I want to make this completely practical. If any part of this video has described something you have already experienced even months ago, here are 3 specific conversations to initiate with your physician. The first, ask about a carotid ultrasound. This is a non-invasive imaging test that uses sound waves to look at the arteries in your neck, the carotid arteries, and measure both their structure and the speed and pattern of blood flow through them. Unlike a standard ultrasound that just takes a picture, a duplex carotid ultrasound gives your doctor both anatomy and function information. If plaque has narrowed a carotid artery by more than about 70%, that is considered hemodynamically significant, meaning it is dangerous enough to seriously impair blood flow. Knowing that gives you and your doctor a roadmap for what needs to happen next. The second, ask for a hemoglobin A1C blood test. This is not the same as a fasting blood sugar test done in the morning. A hemoglobin A1C reflects your average blood sugar over the past 3 months by measuring how much glucose has attached itself to your red blood cells. You cannot fake a good result with one clean day before the draw. It is an honest look at how your blood sugar has been behaving over time. This test specifically catches prediabetes, the zone where blood sugar is elevated enough to quietly damage your arterial lining, but not elevated enough for most people to feel anything. And in adults over 55, prediabetes often goes undiagnosed for years. The third, Ask about a 24-hour cardiac rhythm monitor, called a Holter monitor. Certain dangerous heart rhythm problems, particularly one called atrial fibrillation, come and go unpredictably. Atrial fibrillation causes the upper chambers of the heart to quiver chaotically instead of beat in an organized rhythm. When that happens, blood pools and swirls inside the heart instead of moving forward efficiently. In that swirling blood, clots form. And when those clots eject from the heart and travel upward, they can lodge in a brain artery. This type of stroke, called cardioembolic stroke, tends to be severe. And the tragedy is that many older adults have intermittent atrial fibrillation that a 10-second office ECG never captures because it is only happening for a few minutes per day. A 24-hour monitor catches those hidden episodes. If atrial fibrillation is identified, there are medications that can reduce the stroke risk it causes by 60 to 70%. These three tests, carotid ultrasound, hemoglobin A1C, and Holter monitoring, together give your doctor a picture of three of the most common underlying drivers of stroke in adults over 55. If you have experienced any of the warning signs in this video, these are the evaluations to ask about specifically. Let's talk about the immediate response, because there is a right way to handle a suspected TIA or stroke warning, and then there are common mistakes that people make with good intentions that can make things worse. Do not drive yourself. If you are experiencing neurological symptoms, even mild, even resolving, your reaction time and coordination are already being affected, even if you do not fully register it. A few seconds of impaired vision or arm control at highway speed is life-threatening for everyone around you, not just yourself. Plan ahead. Talk to someone in your household today about what the plan looks like if this ever happens. Who do you call? Who can reach you quickly? Do not take blood-thinning medications on your own initiative. I know the instinct is to reach for aspirin because you have heard it helps with heart attacks. Stroke is not the same as a heart attack. There are two major types of stroke, one caused by a blocked vessel and one caused by a bleeding vessel. Blood-thinning medication helps in one scenario and can be catastrophic in the other. The only way to know which type you are dealing with is a CT scan in a hospital. Let the medical team make that call. Do pay attention to body position. If you or someone else is experiencing symptoms while waiting for help, lying flat with the legs slightly elevated helps maintain blood flow to the brain without straining the heart. Keep the head in a neutral position, not sharply tilted forward or thrown back. Avoid heat exposure, a hot bath, a very hot shower, excessive heat in the environment, because sudden vessel dilation in an already unstable circulation can worsen the situation. Do have a medication list prepared. Emergency teams lose minutes when they have to reconstruct what medications a patient takes. A simple written list kept somewhere easy to find, or even a photo on your phone, saves that time and can directly influence the decisions made in the first critical minutes of treatment. Let me bring everything together. Stroke is the second leading cause of death worldwide. It is one of the leading causes of long-term disability in the world. And in the majority of cases, it is preceded by warning signs that the body has been sending, sometimes for hours, sometimes for a full day or more before the major event. You now know the 5 warning signs to take seriously. Sudden facial drooping or numbness on one side, even briefly. Unexpected arm weakness on one side at rest. A sudden disruption in producing or understanding speech. Temporary vision changes. One eye going dark or double vision or a field of vision disappearing from both eyes. An abrupt balance loss or intense vertigo that appeared with no clear trigger and no prior history. You know that these symptoms pairing up together makes the situation more urgent, not less. You know that the hours after a warning episode are the window for intervention. And you know the 3 tests worth asking your doctor about: carotid duplex ultrasound, hemoglobin A1C, and 24-hour Holter monitoring. One more thing I want to leave you with, and this is the mindset shift that I think matters most. The stroke that you prevent doesn't make the news. It doesn't feel dramatic. It doesn't have a moment where you are aware that your life was saved. It just doesn't happen. Your brain keeps working. You keep walking. You keep having conversations with people you love. That quiet outcome, that ordinary morning, is what all of this is protecting. Write down the warning signs. Share this video with someone who is over 55 and would benefit from watching it. And if anything from today matches something you have already experienced, do not let another week pass without bringing it up with your doctor. I am Dr. Franklin. If this gave you something useful, subscribe and leave a comment below. Tell me one thing from today's video that surprised you. That helps me understand what to cover next, and it helps this information reach more people who need it. And before you go, if your nails have ridges, grooves, or your lunula has disappeared, your body may already be hiding 4 serious diseases right now. I covered every single one in my last video. The link is on your screen. Watch it next. Take care of your brain. It is the only one you have.